Hypertension, commonly referred to as high blood pressure, is a prevalent medical condition that affects millions of individuals worldwide. This article aims to provide a comprehensive understanding of hypertension, its origins, classifications, and the potentially dangerous consequences it can have on one's health. We'll delve into the intricacies of this condition, shedding light on the importance of awareness and management. Learn more, how to manage hypertension, our comprehensive course. Origin of hypertension. Hypertension doesn't discriminate, it can affect people of all ages, races, and backgrounds. Understanding its origins is crucial to grasp the complexity of this condition. While the exact cause of hypertension is often multifactorial, several key contributors play a significant role. Genetics, family history can predispose individuals to hypertension. If your parents or close relatives have high blood pressure, you may be at a higher risk. Lifestyle choices, unhealthy lifestyle habits, such as a diet high in sodium, lack of physical activity, excessive alcohol consumption, and smoking, can contribute to the development of hypertension. Obesity, carrying excess weight, especially around the abdominal area, increases the risk of hypertension. Fat tissue requires more oxygen and nutrients, leading to increased blood flow and pressure. Stress, chronic stress can lead to elevated blood pressure. The body's response to stress involves releasing hormones that can constrict blood vessels, causing hypertension over time. Medical conditions. Certain medical conditions, such as kidney disease, hormonal disorders, and sleep apnea, can contribute to hypertension. Managing these underlying conditions is essential in controlling blood pressure. Early warning signs and risk assessment. Before delving into the dangerous consequences of hypertension, it's essential to recognize the early warning signs and assess your risk. Monitoring blood pressure. Regularly measure your blood pressure, especially if you have a family history of hypertension or other risk factors. Symptoms. Pay attention to symptoms like frequent headaches, dizziness, nosebleeds, and chest pain, as these can sometimes be indicative of high blood pressure. Risk factors. Assess your risk by considering factors such as age, family history, lifestyle choices, and existing medical conditions. Dangerous consequences of hypertension. Hypertension, if left uncontrolled, can have severe consequences for your health. It acts as a silent threat, often going unnoticed until complications arise. Some of the dangerous consequences of hypertension include cardiovascular disease. Hypertension is a leading cause of heart disease. It can damage the arteries, making them less flexible and more susceptible to plaque buildup. This increases the risk of heart attacks, strokes, and other cardiovascular issues. Kidney damage. High blood pressure can strain the kidneys, leading to kidney disease or even kidney failure over time. Managing blood pressure is crucial in preserving kidney health. Vision problems. Hypertension can damage the blood vessels in the eyes, leading to vision impairment or even blindness if left untreated. Cognitive decline. Some research suggests that uncontrolled hypertension may increase the risk of cognitive decline and dementia in older adults. Pregnancy complications. Hypertension during pregnancy, known as gestational hypertension or preeclampsia, can pose risks to both the mother and the baby. It requires careful monitoring and management. Real-life example. To emphasize the real-world impact of hypertension, let's consider a few examples. John's silent struggle. John S., a 45-year-old executive, led a fast-paced life, often neglecting his health due to work demands. His diet consisted of fast food and processed meals, and the stress of his job took a toll on him. Unbeknownst to John, his unhealthy lifestyle had caused his blood pressure to rise steadily over the years, a condition known as hypertension. Despite experiencing occasional headaches and feeling fatigued, he dismissed these as typical stress-related symptoms. One fateful day, John suffered a severe heart attack. It was a wake-up call that could have been prevented with early intervention. John's story serves as a poignant reminder of the dangers of neglecting one's health, especially when living a high-stress lifestyle. Case studies. Let's explore 5 real-life case studies of individuals who have faced hypertension and successfully managed it. Mark's lifestyle overhaul. Mark Johnson. Mark J., a 55-year-old mechanic, was diagnosed with hypertension during a routine checkup. His blood pressure readings were consistently high, putting him at risk of heart disease and stroke. Mark decided to take control of his health by making significant lifestyle changes. He adopted a healthier diet, focusing on reducing salt and saturated fat intake. He incorporated regular exercise into his routine, which helped him shed excess weight. Within a few months, Mark's blood pressure began to normalize. His doctor was impressed with his progress, and Mark continued to maintain a healthy lifestyle to keep his hypertension in check. Lisa's medication journey. Lisa S. Lisa S., a 40-year-old teacher, had a family history of hypertension and experienced high blood pressure during a routine health check. Her doctor prescribed medication to manage her condition. Lisa was initially concerned about taking medication but quickly realized its benefits in controlling her blood pressure. She also started practicing stress reduction techniques like deep breathing exercises and meditation. With the combination of medication and stress management, Lisa successfully controlled her hypertension and continued to lead an active life without complications. Learn more, How to Manage Hypertension, our comprehensive course. Success Stories. Here are 5 success stories of individuals who have triumphed over hypertension. Mary's holistic approach. Mary A. Mary A., a 45-year-old artist, managed her hypertension through a holistic approach. She incorporated meditation and yoga into her daily routine to reduce stress. She also adopted a balanced diet rich in fruits and vegetables. Mary's commitment to a healthier lifestyle resulted in improved blood pressure control, allowing her to continue her artistic pursuits with vitality. Robert's medication adherence. Robert C. Robert C., a 65-year-old retiree, understood the importance of medication adherence in managing his hypertension. He diligently took his prescribed medications as directed by his healthcare provider. By consistently adhering to his treatment plan, Robert maintained optimal blood pressure levels and enjoyed an active retirement. Frequently asked questions, FAQ. Here are 10 commonly asked questions about hypertension. What is hypertension, and how is it defined? Hypertension, or high blood pressure, is a medical condition where the force of blood against the walls of the arteries is consistently too high. It is typically defined as having a systolic blood pressure, the top number, of 130 mm Hg or higher, and or a diastolic blood pressure, the bottom number, of 80 mm Hg or higher. What are the risk factors for developing hypertension? Risk factors include family history, obesity, a high sodium diet, lack of physical activity, smoking, excessive alcohol consumption, stress, and certain underlying medical conditions. Can hypertension be prevented through lifestyle changes? Yes, lifestyle modifications such as maintaining a healthy diet, regular exercise, limiting sodium intake, quitting smoking, moderating alcohol consumption, and managing stress can help prevent or manage hypertension. What are the treatment options for hypertension? Treatment options include lifestyle changes, medication, and sometimes a combination of both. Medications may include diuretics, beta blockers, ACE inhibitors, angiotensin II receptor blockers, and calcium channel blockers. How often should I monitor my blood pressure? Regular blood pressure monitoring is essential. If you have hypertension, your healthcare provider will recommend how often you should check it. Home blood pressure monitors are widely available for self-monitoring. In conclusion, hypertension is a widespread health concern with far-reaching consequences. Understanding its origins, classifications, and the potential dangers it poses is crucial for early detection and effective management. Whether you have a family history of hypertension or not, adopting a healthy lifestyle, regular checkups, and stress management can significantly reduce your risk. Don't let hypertension remain a silent threat. Take control of your health and well-being. If you're looking for a more in-depth understanding of hypertension and practical strategies to manage it, consider enrolling in our comprehensive course, How to Manage Hypertension. This course provides valuable insights, expert guidance, and actionable steps to help you take charge of your blood pressure and overall health. Remember, knowledge is a powerful tool in the fight against hypertension. By educating yourself and taking proactive measures, you can lead a healthier, happier life while effectively managing this condition. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.